So,
I know the both sides of the
so
equation.
Sonny, I'm going to use this for educational
Good,
purpose
good
and on
idea.
internet. Tell me
Yeah.
what you just told me.
I did the 6 OLLIFs last week. Every single patient, every single one of those 6 patients, no complications, blood loss of 50 cc's, all of them went home the following day. This is unimaginable. From the old-fashioned technique that I was doing 10 years ago. And half of this were L5S1 levels where all these other technologies cannot tackle. Okay, you got D-lifts, X-lifts, I've seen it all.
Yeah.
Okay, and this is very, very remarkable.
Now, do you know what's special as well about that? You hit those landmarks in half or 1/3 of the number that I needed.
Well, thanks to you, because you and I to start it up. Was that 3-4 years ago? We did like 30 cases back to back together.
Yeah, but you know.
Yeah, you gotta give. You gave me a big jump start.
But that is what I'm proud of. That you could be much better, faster in that, because you took the time, invest your time.
Exactly.
And learning new thing. And you know, people in your situation who are accomplished, complex surgeon, they just don't want to take their time to learn new things.
That's the inertia and the pride and arrogance.
Yeah.
You have to be humble. Why do we need to be humble and exercise humility? For the sake of patients.
Yeah.
Half of these patients I did surgery last week, they were inoperable by the old traditional method because they're too dangerous and things like that.
They're too old, they're too sick, they're too big.
Exactly, BMI of 50 and all of that. And
now
we are doing surgeries in 1 hour with the 25 cc blood loss.
And the BMI of 55.
Yeah, 6 hour surgery with 1,000 cc blood loss. It's a dramatic.
Yeah.
Dramatic.
So, and I see that younger generation are very receptive for that.
Younger generations, because they're starting with a clean slate.
Yeah.
Old guys, they are still in all their ways.
You and I are old guys now.
Old guys, they got too much inertia, and they got the pride, they got the arrogance. They don't want to change, and they don't want to invest their time because it takes time investment.
Yeah.
You have to take time off your conventional way of doing things.
Yeah.
And go to courses and learn and
being
trained in. It is hard work, but once you go over that hard work, you're going to be rewarded for that.
Yeah, and your patient will be rewarded for
exactly, that. Patient. Our motivation is if we help the patient, ultimately, that's going to look favorably on us. Our goal should be always help the patient.
Yeah.
Okay?
And this is the true answer to question what many people ask me, why not more people are doing what you and I are doing?
Exactly.
That it's inertia, the unwillingness to invest the time to go back to learn things.
Exactly.
And but I remember one day you came back to me in the early afternoon. You told me that you thanked me because you were done early afternoon, and you did all your cases.
Right. Correct.
Yeah, and where you would have been in the surgery for a long time. Whereas I think as well that's important that all those patients probably went home next day rather than sticking around and get the ileus or other complications.
Yeah, so typically with conventional surgery, you do a surgery on a patient, they stick around in the hospital 5 days on average, and you get about 50 phone calls from the nursing staff in the hospital, and you get exhausted at the end of the day. And significant number of them, 2.5% get infected.
Yeah.
Okay, so we have no infection. We don't need to make rounds on these patients. You don't hear from them much.
Yeah. You don't hear them from much, but
And
what's more important, because they're doing well.
Yeah, that's the reason you don't hear from them.
Every call you don't get is because they don't have those problems that they would have with open surgery.
Exactly.
Well, I think that is we are sitting on something that we have to pass on.
This is a huge progress.
Yeah,
this is a huge progress.
Well, thank you, Sunny, for the interview.